Good afternoon, everybody. Thank you for being with us on this beautiful Monday afternoon. We have several things to chat with you about today, and then, of course, we'll take your questions. I do want to begin by just saying that there was a child that was killed last night in a shooting that was in the LaSalle neighborhood, Little Keon Green. He was 9 years old, and you know, every death, every homicide is heart-wrenching, but a little 9-year-old child, it's especially heart-wrenching. So there have not been any arrests made in this case yet. Of course, police are working hard on that. So anyone who does know anybody, please call Crime Stoppers. So it's just a very somber way of starting off today, and my heart goes out to Keon's family, and just very sad situation. So next up, let's talk a little bit about the COVID numbers. Then we're going to talk about vaccinations. There are some new CDC guidelines, a few, and we'll take your questions. So with regard to numbers, numbers continue to be good. Yesterday, the city of St. Louis reported 19 new COVID cases. That brings our 7-day average of COVID cases down to just right at 20, right under 20 per day. And it has been at right around 20 per day for the last 2 weeks, right about 2 weeks. So that's good news. You know, the mitigation strategies along with vaccinations are helping dramatically, not just in the city of St. Louis, but all across the region and frankly across the country. So that's good. Number of people in the hospital, those numbers, the Pandemic Task Force has not updated those numbers yet since Friday, but on Friday it was 262 people in the hospital, 66 on ventilators, and 66 in ICU and 41 on ventilators. And the average number of people admitted to the hospital each day to these 4 major hospital systems is now at 33. We dropped below 40 4 days ago. So maybe down a little bit when we get the new numbers, which that'll be at 3 or 3:30 today, 3:30 I think today. We'll update you. But bottom line, all of the numbers look good, look much better. The city of St. Louis is down to about 7-day average positivity rate of about 3.5%. Excuse me, that's a 14-day positivity rate of about 3.5%. So again, that's good. And you know, we are beginning to ease up, as you know, on some of the restrictions. We did last week approve a plan so that we could have baseball at Busch Stadium this year. It's a limited capacity. It's around 30% capacity. Everybody, they'll sell tickets primarily in blocks of 4, sometimes 2. But everybody will be 6 feet apart. Everybody will have mask wearing. So we've eased up a bit on those large gatherings. And that one, of course, is outside, which is definitely better. Today, we and St. Louis County are both announcing that we will go to midnight closing time on bars and restaurants. That's up from 11 o'clock in the city. The county was at 10 p.m. So we're going to go to midnight. We certainly are considering lifting that even further if we can sustain these low numbers. We do think, at least I think it's important for the city and the county to be as in sync as possible on these guidelines, because we don't want to move people from the county to the city or city to the county and vice versa. So we will also immediately go to a 12 p.m. closing time for bars and restaurants. Still have to socially distance, still have to wear masks unless you're seated at a table eating and drinking. None of that changes at this point. But we are beginning to look at and are beginning to loosen some of the regulation here. while still being cautious and mindful of the variants that are out there and are beginning to spread. Hopefully, hopefully we can maintain our numbers and not see another increase. So this is a little bit of a go slow, and I know that's tough to hear because you're tired of going slow, but here we are with really good numbers for about 2 weeks, and so I think it makes some sense to do that. So that's on the new bar and restaurant closing time. Now, vaccinations. We had another vaccination event on Saturday and vaccinated over, I guess it was 12 or 1,300 people. That's good news. People are finding other places. I mentioned this on Friday, but in case you weren't on Friday, there are 4. On Friday it was 5, but one is not participating. We learned today 4 independent pharmacies that are participating in vaccinations. One is TJ's, which is on South Grand, 3900 South Grand. The other is West Pine, which is 4400 block of West Pine. St. Louis Hills Pharmacy and Gateway Pharmacy are both waiting. They will be participating, but they're waiting for their first delivery of their first vaccine. So that's 4 independent pharmacies. We also have 2 Walgreens and 2 CVS's that are participating currently. We hope and we expect to have more, but currently the CVS at Del Mar and Skinker is participating. CVS at Natural Bridge and Union, and Walgreens at Kings Highway and Natural Bridge, and a Walgreens on Gravois are all participating. Some have vaccine. They all are by appointment only. You can get those. Go to the CVS and the Walgreens website to get those locations. So there are becoming more and more places in order to get the vaccine, which is good. And we are hearing from folks that are beginning to get a lot of notices for appointments. So if you get an invitation for an appointment, please just make one appointment and keep that appointment. Because if you make an appointment and then you're a no-show, whoever's doing the vaccination has held that dose for you and has held that time slot for you. And while we have not wasted any vaccine, when people don't show up, you're always scrambling a little bit. So more and more vaccine is becoming available. In the city of St. Louis, we have currently, we use round numbers here, 115,000 people that are either over 65 or 18 to 64 with underlying health conditions. So that's about a third, a little more than a third of our population. Of those people, 32,000 have received or are in the process of receiving their vaccination. In other words, they've gotten 1 and some of them have gotten 2 vaccinations. So that's about 28% of the eligible people have gotten vaccinations. We have to continue to build that percentage. We want to make sure that anybody over 65 who's willing to get the vaccine, get the vaccination is able to do so. And so we are continuing to work on that. This week we will be doing second vaccinations for a lot of folks, and you'll be notified if you're up for a second vaccination. Most of you already know it. You've got your card, and on your card it tells you when your second vaccination is due. So you'll get notified of that and where it will be. So that's the good news on vaccinations. It's getting better. It's still difficult, no doubt, but there is more vaccine around and more places to get it. Now, with regard, this morning the CDC came out with some guidelines for those folks who are fully vaccinated. And this is a little bit of a change from before. And we'll post this to our website, this link to the CDC guidance, only a couple of pages. And it just says what's changed. If you have been fully vaccinated, what does that mean, first of all? Fully vaccinated means you've had 2 shots and it's 2 weeks since you got your second shot. I know some folks are getting Johnson & Johnson, but though that's brand new. It's 2 weeks since you got your second shot or your J&J shot. After that 2-week time period, what the CDC says is that then you've been fully vaccinated and you can get together with other folks who are also fully vaccinated without wearing a mask. That's good news. What does the vaccine do? The vaccine protects you from getting really sick. These vaccines can work against the variants too, but the story's still out on that one. And the other thing it says is that we know that the COVID-19 vaccine is effective at preventing serious illness. So we'll post this as more and more people are fully vaccinated, especially people in those most vulnerable classes, over 65 or an adult with an underlying health condition. That is one of the things we believe that is assisting in terms of getting our hospitalization numbers down. Just anecdotally, and I mentioned this on Friday, but our police department, both uniformed commissioned officers as well as civilians, last week was the first time in almost a year that no one in the police department was out with COVID or quarantined. So we've had over half of our police department has chosen to be vaccinated, and we've given them several opportunities for that. And each time there are a few more who decide, okay, I'll get vaccinated as well. That's all good because they're first responders. So police, fire, EMS, sheriffs, corrections officers, they have all had the opportunity to be vaccinated, and a majority of them have taken the opportunity. Not all, but a majority. So I think that's all I have for today. Do you guys have any questions?
Couple of questions. Stacia's question is, the low numbers of COVID in the city, is that because more people are getting vaccinated or because testing is not happening as much as it used to?
Well, there is a little bit less testing, but anyone who is having symptoms probably is getting tested because they're not feeling well. But our positivity rate is still only about 3.5%. So I think what that says is that the real numbers are down, even though testing is down slightly. Let me look here. I think I have some testing numbers here. Yeah. So last week, well, let's look to the week before because not all the results are in for last week, but the week before, the week ending 2/28, the city had got results back on 6,300 people who were tested. The week before was 55. At the height, it was running around 7,000 to 8,000. So it's not that no one is being tested. Plenty of people are still being tested. Anyone who has to go in the hospital for any sort of procedure has to be tested. And anybody who has symptoms is getting tested, yet our positivity rate is still running 3.5%. So that's good news.
Jeannie has a question about moving forward because Dr. Fauci has warned about a false sense of security by declining numbers. Would it not be more prudent to proceed cautiously rather than celebrate by allowing the Cardinals to have fans in the stands on opening day?
Well, we are proceeding cautiously. And to say that we're celebrating, I think, is not accurate. The baseball's an outdoor event, as you know, and we're only allowing folks to be in small groups and to have 6 feet apart with everybody. So think of it more like if you were in a park. You're outdoors, stay 6 feet apart, and wear a mask. So we are proceeding cautiously, and that's why we aren't making even more changes. So.
Kathy is asking for clarification about the new midnight closing time for businesses, about when it goes into effect.
It's for bars and restaurants, first of all. That's who the 11 p.m. applied to it. It's in effect now.
We had many commenters, a lot of positive feedback for Dr. Eccles, the mayor, the health department, the staff, the volunteers for a very well-run, organized vaccination event at the Carpenters Hall over the weekend.
Thank you to all of you for noticing that. And we also had a similarly well-run event the week before, the Saturday before, at the Omega Center at Goodfellow and Natural Bridge. It is a really, if you were there at either of those events, you know what a big effort it is. It takes over 100 people to run one of those events. Most of those people are volunteers. Of course, we have health department staff that are there. We have police, a lot of police that are there. That's for traffic. That's for helping to check people in. We use the cadets and the soon-to-be police officers that are in the academy for both of those things. St. Louis University nursing students are there giving vaccinations. We have a medical corps, retired or folks in the medical field that have time and are willing to give vaccinations. So it's a big undertaking, as you probably saw, and we're happy to be able to do it. We'll also be happy when there are more and more places that everybody can get the vaccine, the vaccination, such as the pharmacies, because we do believe that if you're able to get it at a pharmacy close to your house, you probably won't have to wait in line, have an appointment. That'll be even better the more widely distributed this vaccine gets. And that's coming. It's on the way. You can tell it's already increased.
Andy's question, Mayor, is when the supply increases of vaccine, will the city use the Dome for a mass vaccination event?
You know, Andy, we might use the Dome or other large event spaces if there's enough vaccine to do that. If we do that, we will likely do it in connection with the state and the National Guard in order for that to happen. Right now, we are, as you know, vaccinating 1,000, 1,500, 1,800 people on a Saturday. Those are, by the way, mass vaccination events. They're bigger events than most of the rest of the events that you see around the state. It's not the location that is important here, whether it's the Dome or whether it's, you know, on some closed streets. It's not the location that's important. It's the vaccine, having enough vaccine and having enough vaccinators to actually do it. So.
Ashley wrote in with concern about non-mask wearing at a gas station. Report COVID-19 restriction violations.
So quick shop should be wearing masks. All customers should also be wearing masks, but you know, if you're outside pumping gas and you don't have a mask on, you should have a mask. If you think there's a violation of the mask ordinance, you should report it to 622-4800. That's the Citizen Service Bureau. Our health department will make a phone call or pay a visit to that location to see if it's, you know, if it was just one person at one time who was violating, or if it's something where people just are not wearing masks. In which case, as you all know, you know, we first try to give them a warning, and then hopefully we don't have to do this, but then we can close folks down for not complying with the mitigation strategies.
One of your viewers, Mayor, asks about trade shows and conventions returning this spring. Could those possibly be held without any capacity restrictions?
I doubt if they would be held without any capacity restrictions, but just like you've seen with the Cardinals or with the Blues, these large events have to submit plans for how they're going to manage the large event. And in all likelihood, there will be capacity restrictions because we're not out of the woods yet on this.
Okay, last two questions, almost 2:30. When the city makes more federal assistance available for rent, does that apply for landlords in this next round? That is from Portia.
Yes, Portia, and it applied to landlords last time too. We have about 2,000 people on the waiting list for rental assistance. You know, you need your lease, so the landlord and the tenant together usually provide this information, and then the check is made out directly to the landlord. So, yes.
Last question of the day, Mayor, comes from Andrew, inquiring about the road blockades in the downtown area. Wants to know if they're sticking around. He's worried that tourists who see it may not come back.
You know, Andrew, they are sticking around for now, and we've changed some of them, we've adjusted some of them. We'll, when there are large events downtown, we'll probably make some more adjustments. But right now, there are still many people that are not in downtown on a regular basis, and it's our goal to prevent the sort of speeding and reckless driving that occurred last summer.
That's it. It's 2:30.
That's it. Thank you all. Appreciate you being with us today. Have a lovely afternoon. We're getting some great spring weather here, so thank you all. Appreciate it.